Hello everybody, my name is Elijah Clausen and I am ready to do my presentation on amphetamines, and I'm really excited. I was glad that I was able to learn more about them and the prevalence of them, so let's just get going. Right now, amphetamines is the #1 drug problem for Californian teens, which is a lot of people, so that's kind of a crazy statistic there. 600,000 children are prescribed amphetamines, which just shows how many kids have access to them as a medicine, which is just crazy. 30% of all treatment admissions are caused by amphetamines. That just means that, like, hospital admissions on drug-related things, 30% of them are all amphetamines, which is just an astounding number. 36% of college students are offered an amphetamine non-medically, which just means in a normal situation in college, a lot of kids have the opportunity to take the drug, and pretty frequently. 36% is a pretty solid number there. 90% of college students admit to faking ADHD symptoms to obtain the drug. So moving on, we have a bunch of different types of amphetamines here: Adderall, Ritalin, Concerta, Vyvanse, Dexedrine, Dextrostat, Focalins. A lot of crazy names there, but those are the most prevalent types of amphetamine. A little bit more information about each of them. They're most often ADHD medications, as we've kind of touched on earlier. They're not very addictive as when you're young, but risk increases the older you get. 88% of users experience withdrawal symptoms within the first 24 hours, so not a long time at all when you start feeling the effects. It's also very dangerous in this aspect, where it's easy to build tolerance, which encourages people to take higher doses to feel the effects, which is just dangerous for ODing and other issues. Some of the short-term symptoms include psychosis, which is just losing touch with reality, so kind of going crazy, extreme weight loss, suppressed immunity, anxiety, and depression. A few long-term symptoms include increased risk of heart complications later on in your life. And also later in your life, increased risk of kidney failure, higher chance of stroke, increased blood pressure, all which make life later on less fulfilling and harder to do things. Some of the withdrawal symptoms are an increased amount of nightmares during sleep, which I don't know about you, but that sounds kind of horrible. Extreme body aches, extreme hunger, paranoia, violent behavior towards people. All these things could lead you to a lot of trouble, so you have to be careful with that as well. The frequent ways it's abused, it is a stimulant for your brain, so some people get addicted in the fact that they just can't function without it. The most common form of ingesting the drugs are oral. I guess that means pill or capsule, or injection just by syringe. And then a newer way, they call it ice, is crystallized, and I guess they smoke it, which is something I haven't heard before. But signs where you can kind of see the amphetamine abuse kind of come out in either your kid or a student. Behavioral changes: you have increased alertness, decreased appetite, and unusual levels of energy. All could be signs of amphetamine abuse. Mood swings, anxiety, and euphoria. An unexplained improvement of grades. A lot of times it does spark the brain, so that does come into play there. And if your kid is acting secretive or your student's acting secretive, you can kind of start being suspicious of those things. So why do we care as educators about this? Well, 7 million kids in the United States in the school system have ADHD. So without a doubt, you will encounter this problem sometime along your education journey. The best way to start combating the process is you just have to first inform the teachers, the moms, and the dads, the parents, and then the students. They have to know too. So just making sure everybody's informed. And then as teachers, we have to stay up to date with the current events of the drug. There might be new things coming out that we don't know about, but if we stay up to date, it's a better chance that we can catch and help our students in that way. And again, as a teacher, our job is to take care of the student's mind. That is what we're trying to teach. That is what we're trying to grow. And how are we supposed to do that if it's not functioning the correct way because of a drug? And it's our job to help them with that. So Thank you guys for watching this. I appreciate you. You guys have a great rest of your day, and God bless.